What is a disc herniation? What is a disc bulge? What are the causes of disc herniation, disc bulge, and what are the possible treatment options? We're gonna talk about that in this video. This video is for you if you have been diagnosed with herniated disc, slip disc, degeneration, sciatic pain, or just a bulging disc, chronic pain that just does not seem to be going away. Now, I personally have been through one myself, and it took me a long time to recover from it. So I know the lower back pain, especially with the disc injury, could be pretty painful and can change the state of your mind as well. So in this video, I want to talk about that because I see a lot of my patients having an MRI or have been told by their primary care physician, or their orthopedic doctor that they have a slip disc, but they still don't know what is the disc or what is the cause of the issue. So let's start with the basics first. If in this picture I just do some drawing here, we have a vertebrae here, a lower back. We have 5 segments in the lower back, 5 bones in the lower back. 1, 2, 3, 4, 5, and in between those bones we have a disc sitting right in here, and this will be the tailbone right over here, and there will be a disc over here as well. Now, looking at the anatomy, this is a normal bone model of the spine. Again, just like over here, we have 2 bones. So again, bone right there, just like that, a disc in between right over here. Now, looking from the top, from top to bottom, when we look at the spine, this will be the picture over here, where again, this will be the disc over here, looking from the top. And then right in here, we have a spinal cord sitting, and this is the back of the spine, like this, looking from the back. The nerve comes out from the sides, just like over here as well. So that's normal. Now, normally, the purpose of the disc is to absorb shock. Think of the shock absorber on the bicycle or the car, right? If they're not good, you feel a lot of thumping when you're riding a bike, or just all the pressure goes into your hands. Also, the disc is like a rubbery material, so it has a lot of liquid in it, mostly 70% water. So it absorbs all the shock. Anytime you're bending, twisting, jumping, it takes all the pressure. The reason we have this disc here is to keep the pressure, the space open between these 2 bones, so there is no pressure on the nerve, just like over here. Because if there's compression on the nerve, obviously that's not a good thing. Also, having a good healthy disc space, that's gonna make sure the joints are not rubbing on each other as well, back here. With having a normal disc, we can move front and back, bend side to side, and turn side to side without compromising the pressure on the nerve over here, and the nerve can communicate with the brain properly. So again, looking at this anatomy, the nerve is coming out of here, and it runs up the spinal cord, goes up to the brain, and it's the brain that is controlling all the sensation or all the function of the body, right? And these are the nerve roots that are going to every single organ and cell of the body. So when we have a problem at the nerve root over here, it will lead to not only having pain, it will also affect the function of the essential organs wherever that nerve is going. So what are the causes of a disc herniation now? Let's talk about that. A lot of time patients come in. Matter of fact, just early this morning, I had a patient come in trying to figure out, don't know what happened. I just all of a sudden had a back pain. A lot of, the particular case of this patient is a fitness instructor spending hours and hours, training people, doing fitness classes throughout the day, really good shape, physically fit, and yet has been diagnosed with a slip disc. So there are multiple causes. It's really hard to figure out one single cause, but if you look at the big picture, there are the main causes of any herniation or a slip disc is stress. Now, when we think of stress, there's a physical stress, there is a chemical stress, and there is emotional stress, right? Chemical stress, start with that being just carrying extra weight on the body, right? Being overweight, or just not having a healthy diet. Now the nutrition, we're getting to the body isn't good enough, and that's going to cause, to change the physiology of the body, and that's going to affect how the muscle, tendon, ligament is going to be affected. If we're not getting proper nutrition in the body, then, we're not supplying those muscle tissue, tendons, ligaments, the disc, a proper nutrition and rehydration to that area, which is going to start wearing out the disc and the joints in the long run as well. Talk about the emotional stress. Emotional stress or the mental stress, just being fatigued or just depressed or just being anxious, easily getting irritated with things. That's going to cause a lot of tension and tightness into those muscle, tendon, ligaments, which in turn are going to affect the joint mobility again, because all the tissue is attached to the spine one way or the other. And as you lose the range of motion, that's going to start causing more stress on the disc itself. And the biggest reason why people tend to have a slipped disc or herniated disc or a bulging disc is primarily because of a physical stress. Especially, talk about this patient this morning. Being a fitness instructor, she had a really healthy lifestyle. She's eating healthy, she's stretching. However, there's still a lot of physical stress on the body, or physical stress could be just sitting all day at work or standing all day at work. We're not getting enough motion in there. So when that happens, again, our muscle, tendon, ligaments start pulling on different directions. Again, we have muscle on the right side of the body, we have muscle on the left side of the body, right? So there's going to be asymmetry. That asymmetry is what's going to lead to having abnormal, uneven stress on the spine. So looking at this model again, what I drew over here, if you look at this here, this is normal. The disc is absorbing all the shock properly over here. Now, we live under the gravity, again, we can't avoid that, right? Or having all this physical stress, that we're constantly being pressed down. So disc is absorbing all the shock. Now, if these joints are not moving, the pressure goes straight down and the disc material starts to get pushed out going this way or that way. Now, in the other scenario down here, we can see that these are the bumps that we feel on the back. They should all be lined properly. When they're misaligned for various reasons, could be a fall, could be an accident, could be just sitting in one position or just sitting too long or just day-to-day activities physically, whatever we're doing. These joints are either bent, they get stuck in rotation position, or they bend, get stuck in this position, or they just get pressed down and they stay that way. When that happens, that will also go ahead and push this disc out, and this is going to compromise the nerve coming out of that area as well. So the main cause at the end of the day is the stress on the body, which will lead to having misalignment of the spine. The longer that we have the misalignment of the spine, that is going to start compressing the disc and pushing the disc out and causing a slip disc, bulging disc, herniated disc, things like that. So how do we treat that, and what do we need to do? Now, first of all, when most people have a slip disc, herniated disc, or bulging disc, they're dealing, sometimes the symptoms will include back pain. Sometimes, symptoms will include pain going down the leg. Sometimes there'll be nerve pain as well. So you have numbness, tingling. There may be, lack of circulation down the leg as well. So anything is possible when there's a disc is involved. And most people will usually end up wanting to do some stretches, try to get some relief. If that doesn't help, they go to their primary care doctor or the orthopedic doctor or the urgent care, and they typically end up getting anti-inflammatory medication or a cortisone shot, or just something to relieve the pain. And also at the time, if it's still not working, they are referred to physical therapy, which is again a good option as well. So these are all good options, which to help decrease inflammation, and also with the physical therapy. And many times you can work on those muscles to help strengthen those muscles. But again, in many cases, especially in our office, we see a lot of patients that have tried all of those things that has not helped them. In some cases, things have gotten worse. So, and purely because we have not taken the pressure off of these nerves. So again, if they're compressed and the disc is pushing out and pressing on the nerve, it's a mechanical pressure, and that pressure has to come off. And if you don't take the pressure off of the nerve, then no matter what we do, we may get a symptom relief, but in the long run, we're still not fixing the problem at the core. So we need to, take the pressure off. So in many cases, when all of those things fail, a lot of these patients are told to have a surgery, and they go for a surgical consult. Now, if you've been told that, at least do your due diligence and talk to maybe 2 or 3 other specialists and see what their opinions are. Now, we have seen many patients in our office that have been told they would need to have a surgery, again, with specialized treatment that we do in the office, such as spinal decompression, which has shown to take the pressure of the disc and allow the disc to rehydrate and reheal, has helped a lot of these patients avoid surgery. Now, obviously, if the disc injury has gone too far where we're losing bowel and bladder function, then you obviously need to have a surgery, because at that point it's too late. So again, these are the options for the treatment. So talk about this, 2 different models going over again. This is the normal disc, where we have a good space where the nerve's coming out, and this is an unhealthy disc. Unhealthy disc is when we have lost all the water out of this. So looking at the disc from the top to bottom, this blue line over here is the outer layer of the disc, which is the annulus fibrosus, which is the basically the layer which is intact, and the red thing here is the nucleus pulposus, which is the center of the disc, the jelly-like material. When we have an injury or misalignment for long enough to the spine, that's going to push that out and going to cause that popping out of the disc. When the jelly is pushing into the blue, that is called a bulging disc. When that blue layer, the annulus fibrosus, that layer breaks, and when we lose the liquid inside that comes out into the out of the disc, that's called a herniated disc. When the longer we have a herniated disc, we lose all the liquid from the inside, and the disc is desiccated, the disc is degenerated, and the joint starts to jam into each other, leading to have more compression and things such as spinal stenosis, arthritis of the spinal joints, leading to have chronic lower back pain as well. So again, those are the progression and the symptoms related to disc injuries. Again, if you have any of those conditions, and if you are needing for solution beyond standard medications or physical therapy and being told you need to have a surgical, surgery for your lower back pain, there are other options. And the purpose of this video is to give you that information. What is a disc injury, the anatomy of that, what are the possible treatment options? And if you need any help, leave a comment below so that we can help you find the answer to that. And please subscribe to the channel here so that we can give you more information going forward regarding how you can lead a better healthy lifestyle going forward.